I am Dr. Arun KN, consultant nephrologist at Bhagwan Mahavir Jain Hospital, Bangalore. I thank Zydus for giving me this opportunity to discuss a few points regarding COVID-19 as it refers to my specialty. As we know, patients with renal dysfunction or any other renal disease, including nephrotic syndrome, are at a higher risk for infections, including COVID-19. What are the special conditions that a nephrologist faces in this situation? As we know, almost 80% of our patients are hypertensive, and hypertension adds to the risk of COVID-19 infection as well as the overall outcome with COVID-19 disease. The next is diabetes. More than 50% of our patients are diabetic, and they too are in the same risk zone. The other things that happen is our patients have anemia, they have malnutrition, which can also contribute to worse outcomes if they develop COVID disease. So, what are the things we have to remember in this setting? One, if you are a patient yourself, see to that you do not get in contact with patients who have COVID-19. But sadly, many of you who are on dialysis will need to go for dialysis where you get exposed to the hospital situation, which can increase your risk for COVID-19. But when in the hospital also, see to that you keep social distancing, you keep your hygiene proper, use the sanitizer repeatedly, and see to that the other patients and their relatives keep a distance from you. And if you find anybody or yourself having signs and symptoms of fever, cough and cold, immediately report to the hospital staff and see to that isolation is done and spread of infection is stopped. The group of patients who are not on dialysis, who have associated hypertension, who have associated cardiac disease, can do this much more easily because you are not exposed to the hospital environment. A patient of cardiac disease and hypertension, avoid going to the hospital. You can do this by being strict with your medications, being compliant with your medications, and avoiding getting fluid overloaded. Avoid drugs and high salt diets or a high fluid intake, which can predispose you to develop these symptoms. Keeping a regular dietary habit, regular exercise will go a long way in keeping you healthy in these times and avoid going to the hospital or to a healthcare facility where the risk increases. If you can talk to your doctor telephonically, get his advice for smaller symptoms that you have and avoid going to the hospital if it can be avoided. The other group of people are the relatives of the patients who have any of these diseases. So it is imperative for them to prevent their relative or the person whom they are taking care getting the disease. So they have to maintain social distancing. They have to do strict hand hygiene, especially when you are serving a patient who has any of these diseases. A fecal-oral transmission, that is, food can also contain the infection. So be especially careful with hand hygiene, etc., when you serve a patient with any of these conditions. The other group I would like to talk about is the patients who are being served in the hospital have to be careful with the staff. The staff of the hospital, especially the dialysis unit, have a higher risk of getting contaminated. So I do advise them to follow all the things that have been advised by their hospital, including personal hygiene, including use of masks and caps and gowns or PPE if it has been advised. And the patients have to see to that the staff follows the orders given by the hospital for the safety of the personnel looking after them as well as for their own safety. So with all these measures, I hope we get over this pandemic with minimal infections to our patients. And if at all we are unlucky to get an infection, let us see that the infection doesn't lead up to complications and morbidity and mortality. Thank you.